All right, hello everyone. So this is part 3 of our basic massage protocol for beginners. I have already repositioned the client, and for Sidelying. So I took that rolled up towel out from the chest area, and now I'm actually just going to unfurl it and lay that right over top of her. If the client's too warm, I don't force them to have this on, but usually this is around the time if a client's going to start to get cold, they will, after about 15-20 minutes on the table. But this will also help me with draping, and we'll see that in a little bit. The other bolstering to keep in mind is I have a square bolster here for under. It's a wider square bolster right here. This is just a big chunk of foam, so it's more stable. It holds its shape. That way it keeps her hips in line. All right. So I have to make sure the bolsters are set up. She has a pillow for underneath her head. I made sure she's warm and comfortable. And then we move on with the massage. So my starting point will be here at the upper leg. May not be able to see all of this particularly well, but you'll get the gist. So my idea here, particularly with what we call the shins and calves commonly, is there's 3 compartments to consider. There's the muscles on the lateral side of the fibula, which do certain motions, specifically eversion at the ankle. Then there's muscles more to the front, the anterior side closer to the tibia. Those are more about dorsiflexion and extension. With the calf muscles, you have gastrocnemius and soleus here, which become the Achilles tendon. Those are all about plantar flexion, and gastroc even facilitates flexion at the knee. But underneath of that, and I'll be able to get that even better here at this leg, underneath of those muscles, a little bit more to the medial side of the leg, so I can access the muscles I'm about to talk about easiest from this position, because I can get on the side of gastrocnemius and soleus and get to the muscles that are actually underneath of them. All of these muscles that are underneath those big calf muscles go down into the foot. So the flexors of the toes, and muscles that are involved with other aspects of plantar flexion of the foot are hidden underneath of the big calf muscles. So when you see me do these knees and movements here, this Sidelying position is very helpful with getting to certain layers of tissue. So we make contact. I'm just moving the skin. Get myself set. I do not feel like I'm going to need to apply lotion. So I'm going to try doing my compressions, glides, and kneads without lotion first. I'm going to do my pressure check-in. And it's just right. Okay. And then I'm going to turn that compression into a glide. 1, 2, and 3. In this case, I started my glides closer to the knee and then worked my way down. I was more on the lateral side. So I was thinking the peroneal muscles of the fibularis muscle group. Now I'm going to shift to where my forearm is making a little bit more contact with the front of the shin, so the anterior aspect. I'm just to the lateral side of the tibia. And you'll see a little trick here where I support her foot so that she doesn't slip away from me as I apply pressure. If I just do this, and she naturally is going to move out of the way. So if I just put my hand here at the back of the heel around the calcaneus, it gives me a low counter pressure, stabilizes her, and ultimately this allows me then, if I just move my arm back and forth, I can couple during all these gliding strokes a little bit of joint movement. It could be that I just hold here at the foot, move the foot back and forth a little bit. If I can, I include the joint movement while I do the glides, then I don't have to do it separately. So I did my glides, now knees. Here, make these knees big. My palm is starting all the way over on the front of the shin, thinking like those tibialis anterior and extensor muscles. This other hand is reaching all the way to the medial side of the calf underneath gastroc and soleus, so that I get a big change of shape. And as I do this knead, I'm going to end up changing the shape of every single muscle in this lower leg region. By making that knee very big, I'm getting all the muscles that are involved with every motion for the foot. Okay, now I did the joint movement. If I needed to, then I just pause. And with this, I can do some knee movement here. I've already done that elsewhere, so I don't worry about that here. Here I think about the ankle. Roll the ankle around. I kind of hug the foot, hug the arch of the foot with one hand, and take my other hand, and just think about kind of bending those metatarsals back and forth. Nothing aggressive. Ends up feeling and looking a little bit more like I'm just gliding on the top of the foot. And there's some important muscles. They're small, but very important muscles there, even on the top of the foot, that usually don't get addressed. The idea of what do we do for the tissue of around the calcaneus and heel. This is a better position for that, because I basically just sandwich the heel between my fingers and my palm, and I push my palm down on my fingers, and that pulls that tissue away from the calcaneus. It's a beneficial thing to do for an individual with plantar fasciitis, for example. But in general, it's good to just work on feet no matter what. The only things we usually have to worry about there for clients is if they're overly ticklish. So I work the top leg. I'm going to come all the way around. I'm going to work on the bottom leg. Now here I just reposition the client a little bit. Really bunch that blanket up. Now having that blanket, what I meant to say there is it helps me create a big bunch of sheet, a big roll, so that I can move that without having to make any direct contact with the client, particularly closer to the pelvis. It's just a smarter, safer option. So I'm going to move this so you guys can see a little bit better. Now, same principle. I am thinking, I was talking about here at the calves, I can get better access to the muscles of the posterior thigh and the medial thigh, as well as the calves in this position. So I'm going to be applying my glides, in particular, thinking about the adductors, the adductors here on the medial thigh, and then shifting my application more to the posterior side, thinking the hamstrings. It doesn't end up looking very big, but one is focused toward one group of muscles and the other is focused toward another. But I can rhythmically transition from one to the other. I work more on the medial thigh, so maybe more straight down to the table, and then I shift so that my forearm is more on an angle and I'm pushing more into the posterior side of the body. I can go from adductors to hamstrings. So let's start that over. I undrape the area, make contact. I am careful here, particularly in the medial thigh, of open palm contact. So you guys are seeing me do this application a lot with my hands so you can see it, but I can facilitate that whole idea of moving the skin and superficial fascia with a forearm. I just have to pay attention. And you will build up your skills with your forearm the more and more you use it. So please use your forearms as much as possible. Initially, it's pretty cumbersome because it's not a movement that we usually do with our bodies, but the more you practice, the better you will get. So that was just me moving the superficial fascia. Now I'm going to apply compression, get my pressure check in. I'm good right there. And then I turn that into a glide. Hard to see, I know, with the sheet in the way. 1, 2, and 3 glides for the adductors, 3 glides for the hamstrings. 1, 2, and 3. Now, with that this other hand was here just above the knee, and as I was applying the glide, I was pulling a little bit, and I can create the twist that we need for the knead by doing that. This keeps me from having to open palm knead here at the thigh. So I'm kneading by doing this. This hand's here down by the knee, and here's my forearm, and I'm just pushing the tissue with my forearm and pulling the tissue with my hand. And joint movement here is very convenient because I can bend the knee back and forth if I want. One technique here, if I was trying to include joint movement while working, is I bring the client's leg over. Best practice would be to get the sheet as a sanitary barrier between you and the client. And then, let's say for an area that's hard to get to, which would be the attachments of the hamstrings, which come over a little bit more medial and attach up onto the ischium. I'm going to apply pressure over the sheet, and either I can use my body to bend her knee back and forth, or in this case, I could have her move her knee back and forth. So a very convenient way to apply compression to these tissues while including some joint movement. Okay, and I work my way down. I'm here at the calves. I'll be blocking the camera when I do this, but usually I work this way. This way. That means I've taken the tissue and I've worked on it parallel to the bones, going down toward the foot. Then I go perpendicular to it. And then I go parallel again, but going away from the foot. So this would be a case where in my routine, I choose to, after I've made contact, move the superficial fascia. I do a gliding stroke down. Then I do kneads across. And then I do more gliding strokes up. Then joint movement. If I can oscillate, I could always just rock and oscillate the tissue. In the event that I felt the calves were particularly tight, maybe it feels like something stuck together here, this general oscillation and rocking of the tissue back and forth can create friction between those layers. And if something's glued down, for example, hopefully I break up that glue and get everything sliding again. So, on and away, moving my way down to the foot. This position, sidelying in general, for being able to work on the top of the foot and the bottom of the foot, is by far the most convenient. So in this case, here I am, just cradling the foot. This is partly to protect the toes. I usually position their toes so their toes are making contact with my bottom forearm, and my top forearm comes in, and it just fits right into the arch of their foot. I change my direction. So now if I'm following the line of the foot itself, I'm going perpendicular, on an angle, and then parallel. And I just switch it back again, go diagonal again, perpendicular. I change my whole body. I'm picking up my back foot and I'm changing my whole body's orientation. And I come back out of that. You're seeing me shortcut a little bit for the sake of the demonstration, but like all things, as you're beginning, if you have to do a pressure check-in or feel like you should, do it. Here, I tell you to watch a little bit with moving, grabbing individual toes. If I do anything, I grab the second to fifth toes, move them back and forth, just as one. I literally just grab all the four smaller toes between my fingers and my palm, small squeeze, and just rock back and forth. And then here, I'll grab the big toe individually and maybe squeeze the heel. That gets the joint movement of the individual toes, but limits our chances of tickling, which is just never comfortable. So, okay, and we're moving our way up. After working on the feet and coming up to the upper aspect of the body, particularly the head and shoulder, you always make sure you apply a fair amount of sanitizer. Just in general, anytime you're coming close to their head, face area, you want to be applying additional sanitizer. Although you've been touching their body, it's just as much for sanitation as it is for just making them not feel weird in the fact that I just massaged her feet and now I'm near her head. So sanitize before you work on the head and scalp. In this area, what you're going to see is the benefit of me having this blanket is I'm going to use this so that I can bunch it up and around, protect the uncovering her body as I undrape the side of her torso. So I'm going to have her bring her arm out and on top of that sheet for me, please. And I just step into a position, let them get their arm out. I'm going to have you bring it down to the side of your body. And then I just use this blanket. I take one part of it, make sure I don't cover their face and their mouth. But if I take one part of that blanket and just set it across the neck and shoulder area, then I'm able to use this with their arm to hold the sheet in such a way that as I bring it down, only the tissue area that I want to work on will be exposed. So, all of this. Now, another component you could include with this is a pillow for them to hug at the front of their body. That would obviously offer an additional level of protection. So, from this position, this is the best angle you have. It is not necessarily wrong to work this way up, but I find that starting out, it is easier for you as the therapist to get more on the side of their ribs, which is where the latissimus dorsi and serratus anterior are located. You don't want to be too much on the scapula. So by taking her arm here and going back, and taking AB ducting her, and then going into extension a little bit, that will move the scapula out of the way for me. So when I apply pressure, I'm on the side of the body. Now, for people in the classroom, they might have seen me do this, where I hug the wrist between the pad of my thumb, and I'm able to hold on to the sheet and apply gliding strokes while basically just holding their wrist. For me, it works good. You just have to figure out your hand orientation. People try to do this and everything. My hand stays just like this. I just put their hand, wrist right in the hook of between my index finger and thumb, and then I no longer have to hold their arm with this hand, and I can use this hand to hold the sheet down. So gliding strokes here. This is not an area of the body where it's conducive to do kneading, so I don't do much kneading there. I do more compressions and gliding strokes on the lateral side of the body, but very important to work here. Worst case scenario, work over the sheet and use joint movement to create that friction between the layers of tissue. Okay. Keeping with that principle of working over the sheet, it can be easier when just getting this low back spot. So I'm feeling the top of the ilium and then the bottom of the ribs. My forearm is going to make contact with the top of the ilium, and I'm just going to sink straight down until the optimal pressure level is achieved. I make contact and then I just let that guide me straight down. That pressure is okay right there? Or do you need more?
That's good.
Okay. This is a pretty sensitive area of the body. As said, with the lateral raphe, there's a lot of muscles that attach here. So it's not uncommon for it to be sensitive. But that has to do with the fact that many structures that might be causing some of the negative symptoms our clients are experiencing, you are affecting them in some way by working here, because so many structures attach into this one location. So I can have her use big, deep breaths. That moves the ribs And by moving the ribs, that's going to create a change of shape and friction between those layers. I could have her just roll her hips kind of around in small circles. I could have her lift and move her legs, particularly the bottom leg. She could lift that bottom leg up off the table. By activating the opposite side adductors, it will trigger these muscles on the lateral side of the body to activate as well. The lateral flexors of the spine are paired with the adductors and abductors of the hip. So by activating movements at the hip, I can get these muscles to turn on and off. It's a very simplified way of explaining that. Now what's nice is I don't have to worry about the draping so much. I can just cover her arm back up with this blanket. Now her arm is holding that sheet down while I work here at the shoulder. So starting, you gotta get good at moving hair occasionally. I usually you try to get as broad a base with your hand as possible and draw the hair up and away. In the event that the client is wearing a necklace, you have to get good about grabbing the necklace and maybe moving it and then holding it in position while you apply these manipulations. That way you don't pinch the necklace into their skin. So I'm going to use a soft fist here. Any of this could be done with a forearm. And this is a case where I go downhill. It's not a big glide. I start with that compression and get myself out of sorts. I've made contact with the skin. I would want to, if possible. This angle facilitates that ability to be able to just move the superficial fascia. You can see here my other hand's going to be a little bit in the way. But just grabbing basically the skin of the shoulder, upper traps, the neck area. This could be something where it does feel good to just do general, lighter, pressure-based movements and manipulations here. But my mind as the massage therapist is predominantly thinking about that skin, superficial fascial movement. Then from there, this is where I would start. I walked around too early. So this is where I would start at the shoulder, and then I can use a soft fist or a palm in this position. Pretty light, stay light here at the neck to start. I'm showing this with various options. The soft fist you have to watch, you don't hit the base of the skull too much with your knuckles. The palm works good, but you have to pay attention to where your fingers are, and you don't inadvertently pull hair. I actually use a forearm here. It's tough to see in the video as well, but I make contact with the upper traps. Just let gravity take me to the neck, and then my force and direction goes right up into the base of the skull. And then I do a pressure check in with her, make sure my pressure is just right. You tell me when it's just perfect. Mm-hmm. And then I just can hold a compression. If I do anything, and maybe I change my direction of force where I feel like I'm trying to pull that tissue away from the spine. And I might just do that a few times, where I go up toward the base of the skull, and then I change, and I try to take that tissue away from the spine. So toward the skull, and then following the line of the skull, basically going toward the jaw. Never, ever, ever crossing toward the interior triangle of the neck. That meaning I don't go past her ear. I see the edge of her ear. All my compression should be behind the ear, basically between the ear and the spine. From this position, I can very easily use a forearm to get a good compression of the upper traps, or use a forearm or soft fist. With this, if I'm going to glide, it's one of the cases because of the steepness, how steep this hill is. I go downhill. I'll stabilize the shoulder, get a compression, and then as long as I don't have too much lotion where I slip, I just let gravity create the glide. So although I'm going downhill, I have enough friction to not slip. And I just start closer to the edge of the shoulder and work my way toward the neck. And then here is a good position as I redrape. Can do a little scalp work. With scalp work, make as much contact as you can. You know, hands, fingers, all making contact, and then move the whole of the scalp as one unit. That keeps you from pulling hair, and it just feels better. If there's a nuance to this, I let my palm compress the temporalis muscles a little bit. But for the most part, I just think about really moving the scalp around. But before doing that, you might want to check in with the client doesn't mind that their hair gets messed up. I have had people where they had a business meeting or something afterward, and I didn't think to ask. So, okay. Now, to reinforce that protocol, I start here. At the end, I would be here to grab this bolster, have her turn on her other side, re-bolster, make sure she's comfortable, and then I'd start the process all over again. But I work the top leg, specifically the shin, foot, bottom leg, adductors and hamstrings, calves, and the structures underneath those like tibialis posterior and flexor digitorum, flexor hallucis. Then work into the bottom of the foot, walk my way all the way up, used the blanket and towel to help me drape the side of the torso, worked on the side of the torso, specifically latissimus dorsi, serratus anterior, worked on the low back, quadratus lumborum, that whole lateral fay unit, and worked my way up to the neck, shoulders, and then ended at the scalp. So then I would turn her, do the other side, and then I'll see you guys again in supine.